How does the urethra connect to the urinary bladder? Imagine your body's plumbing system, where the bladder acts like a storage tank for urine, and the urethra is the pipe that carries it out. The connection point between these two structures is called the internal urethral orifice. This opening is located at the very base of the bladder, within a small triangular area known as the trigone. The trigone is important because it helps keep the connection stable and prevents urine from leaking back into the bladder when you urinate. The bladder itself is a hollow, muscular organ that holds urine coming from the kidneys through tubes called ureters. At the bottom of the bladder, there are two urethral openings for urine to enter. The single opening at the base of the bladder, the internal urethral orifice, is where urine exits into the urethra. This opening is guarded by a ring of smooth muscle called the internal urethral sphincter. This sphincter works involuntarily, meaning it automatically opens or closes to control urine flow without conscious effort. The urethra begins right at this internal urethral orifice and extends outward to the external opening on the body's surface. In males, the urethra is longer, about 20 centimeters, and passes through the prostate gland, which surrounds the urethra just below the bladder. The prostate size and health can influence how easily urine flows, especially if the prostate enlarges or develops tumors. The male urethra has four parts: the prostatic, membranous, and spongy or penile urethra. In females, the urethra is much shorter, around 4 centimeters, and runs directly from the bladder through the pelvic muscles to a small opening just in front of the vaginal opening. Because it is shorter, women are more prone to urinary tract infections, especially if bacteria enter the urethra. Near the bladder, the lining of the urethra is made of transitional epithelium, which can stretch as the bladder fills and empties. Moving further away from the bladder, the lining changes to pseudo-stratified columnar epithelium and then to stratified squamous epithelium near the external opening. Urine flow from the bladder into the urethra is controlled by two sphincters. The internal urethral sphincter, made of involuntary smooth muscle, keeps urine in the bladder until it's time to go. The external urethral sphincter, made of voluntary skeletal muscle, allows you to control when you urinate. In the context of prostate health and prostate cancer, the passage of the urethra through the prostate gland is especially significant. When the prostate enlarges or develops tumors, it can compress or block the urethra, leading to symptoms like difficulty urinating, a weak stream, or urinary retention. Understanding how the urethra connects to the bladder, especially the prostatic segment, is crucial for diagnosing and managing prostate-related urinary issues. So, in summary, the urethra connects to the bladder at the internal urethral orifice within the trigone area, with the internal urethral sphincter controlling the flow. In males, this connection passes through the prostate, making prostate health directly relevant to urination. Always consult a healthcare professional for personalized advice if you experience urinary symptoms or have concerns about prostate health.